Hello everyone and welcome to today's presentation. My name is Wendy Denyu. I'm here today to present my evidence-based care plan today that was created from the VillaHealth study that was presented earlier in Assessment 4. In this assignment, I will propose a care plan to assist the patient and her family and present them with relevant information to achieve a positive outcome. In this process, I will be discussing the benefits of remote collaboration, and I will also be incorporating an evidence-based practice model directly into my care plan. The VillaHealth patient is Caitlin Bergen. As some of you may know, Caitlin was recently hospitalized, and while she was there, she was diagnosed with cystic fibrosis. Caitlin is 2 years old, and this was discovered after her second hospitalization within 6 months for pneumonia. A sweat chloride test was completed and found to have 65 milliequivalents per liter, and per Caitlin's mom, Janice, Caitlin tastes salty when she kisses her. With all of these factors, Dr. Erica Copeland gave the official diagnosis of cystic fibrosis. With this being a new and lifelong illness, a collaborative effort has been made to assist the Bergens in learning about this disease and to provide support throughout this difficult time. Caitlin's pediatrician, Dr. Benjamin, has been updated, but he reports that he has never cared for a patient with cystic fibrosis. Telehealth visits have been an option for Janice when she has questions regarding caring for Caitlin and any concerns she may have. This is very important as they live in a rural town of McHenry, which is over an hour away, and these visits have been able to help determine if Caitlin needs to be seen for further evaluation. Given all of these factors, it was determined that a care plan for Caitlin should effectively be put into place to assist with the changes that are occurring and to help with the coping of this illness. Now, we should all understand exactly what cystic fibrosis does to a person. Cystic fibrosis can be described as an autosomal recessive hereditary disorder. This is caused by a gene mutation. This can affect a respiratory, digestive, and the pulmonary system, with production of a dense mucus that can affect the glands in these systems, according to Strzelczuk-Jedka in 2019. Now, prior to leaving the hospital, Dr. Copeland assisted with coordinating some teaching from Rebecca Helgo, a respiratory therapist, and from Virginia Anderson, a pediatric nurse. It was discussed amongst them some of the interventions that have been put into place so far to assist the Bergens. Per Dr. Copeland, pancreas enzymes and a high-protein, extra-calorie diet has been started. Additionally, she has recommended the fat-soluble vitamins A, D, E, and K. Patients who have pancreatic insufficiency will require pancreatic enzymes and fat-soluble vitamins for the rest of their lives, according to Steinberg from 2021. Respiratory has been providing aerosol treatments to help thin the secretions. At this time, Caitlin is too young to cough to help clear mucus. With that, Rebecca, the respiratory therapist, was able to teach Caitlin's mom, Janice, chest physiotherapy to provide percussion. So far, Janice has been able to reach out with questions over video calls. With interventions already in place in regards to diet and teaching effective ways to clear mucus, there has proven to be an effective partnership with remote collaboration in regards to the team caring for Caitlin. While telehealth is not the most ideal situation, it can still be beneficial to Caitlin and her family. However, there should be interventions that allow for a visiting nurse to come and assess Caitlin if need be. This can be an intervention that is incorporated into the care plan to provide the Bergens with a resource that can help determine if Caitlin will need to be evaluated in a medical setting. While care for a young child with cystic fibrosis is a concern, the evidence gathered thus far shows that supplementation of the A, D, E, and K vitamins, as well as the addition of enzymes and dietary changes, will be beneficial to the patient. With these changes, there should be a dietitian to assist the family in ensuring that Caitlin is receiving proper nutrition that focuses on following a diet that will be beneficial to someone who has cystic fibrosis. Recently, a study was done in Europe that consisted of a mobile app that allowed participants who have cystic fibrosis to help manage their nutrition related to the pancreatic enzyme replacement therapy, or PERT for short. The study showed improved fat absorption, with participants reporting a higher quality of life, according to Calvo Lerma in 2021. This evidence-based result could be an invaluable resource to Caitlin's parents. With improvements in technology such as this, with intervening early in the disease process, I believe that this can be an effective tool to help manage the care of the patient, as well as to be a resource to the child's parents. For Caitlin's care plan to be effective, remote collaboration amongst specialists is necessary, and a dietary consultation to assist with creating meal plans should be implemented, as well as mobile applications should be utilized and taught to Caitlin's parents to help create the best possible outcome for living a quality life with cystic fibrosis. Given the severity of the disease, however, I do believe that there should be an annual meeting of all members involved in Caitlin's plan of care. This would give everyone a chance to collaborate in one setting and to have an open discussion on what is or is not working with the care that she is receiving. I believe that this would also provide an opportunity for Caitlin's parents to discuss any concerns that they have and to help make further referrals for the family if necessary. While an annual meeting is what is being proposed, this could be changed to meet the needs of the patient and family to be more frequent if necessary. While collaborating with the team and creating a care plan, I focused my approach on the Johns Hopkins model. With this model, a question is posed, evidence is gathered, and then the information is presented. For the care plan, the question I focused on was how to effectively care for a patient with cystic fibrosis. I then researched cystic fibrosis and how to effectively care for someone with this condition. It was then that I was able to determine that dietary changes played an integral part in maintaining improved outcomes with this disease. That is why I proposed that dietary be involved in the care plan alongside the team of remote collaboration with doctors, pediatric nurses, and respiratory therapists. Additionally, parents and any adult caregiver should be provided with education on how to properly perform chest physiotherapy as part of the care plan. Also, it should be reiterated to Caitlin's parents that it is of the utmost importance to continue the vitamin regimen for vitamins A, D, E, and K that was ordered by Dr. Copeland. It is the implementation of these evidence-based resources that will best assist the family of learning to manage the difficulties of this disease and how to best fight against its detrimental effects for the best possible outcome for Caitlin. While cystic fibrosis cannot be cured, by providing the patient and her family with the tools to fight this disease early on, I believe that we're giving her the best chance of long-term survival with this illness. In a chronic illness such as this, education and early intervention are critical to the patient's outcome. While remote collaboration is not the most ideal situation, this care plan at least provides an opportunity for Caitlin to see specialists that can participate in her care and an opportunity to have everyone from the care plan to come together at once. These are interventions that are invaluable and which will ultimately be needed to help save her life. Thank you for listening to this presentation.